This is our fourth presentation, and it's November 4th. And next slide. Dear, how do I get to the next slide? See, I need her help always. Okay. Yes, I think I'm fine. The current situation with COVID-19 is changing very rapidly, as you all know. Information is relevant to today only. It might be different tomorrow. And we all know that. Thank you for your interest and joining. And we had a large group, and we did send a lot of invitations. Since it's a recurring meeting, I think people get the best when they can, which is fine. But the information will be different. So as you know, this is a viral illness, and it can spread from person to person, and that's how we have to take measures to stop spreading the virus. Can we stay Cambria infection-free? Yes, we got to keep working on it, and it's possible, achievable, and it will be commendable. It will definitely prevent death. These are the current numbers. You can see that worldwide, 48 million over now, and 1.2 million deaths, and ever increased in the last couple of weeks. In the United States, we had 9.6 million cases with 238,688 deaths. And Wisconsin, 238,000 cases as of today, and number of deaths to 2,100. Columbia County, the numbers of cases went up by 300-400 people, and the number of deaths same as last week, so which is a good thing. Now, last week someone, I think, the global psychological effects of pandemic. Now, this is being universal disease. It spread so fast, involved so many people, and there was no definite treatment available.
Another load.
Due to that, people were mainly isolated, and quarantine was the only recognizable and useful preventive measure. So people being affected or not affected by it, by their families, or just taking precaution, were isolated. And there were definite fears in mind due to lack of treatment, lack of antiviral drugs available. The medication remdesivir is available, but it is only recommended for the patients who are admitted into the hospital. So the other medications were dexamethasone, which is cortisone, and it's not recommended as an outpatient either. And initially, the medicine they talked about was chloroquine, an anti-malarial medication. It showed some effect on shortening the disease, but CDC also took that away, so it's not indicated for COVID. So definitely things to worry about. And the second point was social distancing. And because the droplet infection carries the virus, the heavier the drop, the shorter the distance. And if it is like a fumes or aerosol, the virus can go further down the road. So social distancing of 6 feet or 10 feet was affecting people. So they were not able to have meetings or meet friends or go out or even in the family sit together. So that has caused a lot of mental anguish and self-isolation and quarantine because the incubation period for this virus is 14 days. So, so if somebody is going to be quarantined, they have to be 14 days. And so that was very hard on people to be alone and quarantined at home or wherever their nursing homes. They were, just have to remain without meeting other people. So this brought in lonesomeness and lack of activities and continued into depression and anxiety, inability to sleep, and not able to finish the job. And economic stresses, uh, the wages were affected, the earnings went down, and some people lost the work, and because they couldn't travel. So that was another reason that they had limitation of opportunities for the job. And it caused a lot of economic stress upon them. Their expenses like mortgage and car payments and medical payments, they stayed the same. And there was no relief on that. So I have put together a access line uh, to the county, uh, and these are two uh, links, and I will send you these slides so you will have them in case you need to look into those websites. And I think it's a good link of resources available for Columbia County. So, I'll have these slides to you. Now, many companies need to do more to address challenges employees are facing during COVID-19. And in the past few months, this was the survey which was done on the employees. And you can see there's three columns: the fathers and mothers, the parents, senior level men or senior level women. This is at work. Black men and black women, and at work or at home. You can see across the board that the women are more vulnerable. They get burnt out, exhausted, and felt pressure at work. And it was expected that they will work more. And so they get exhausted and burnt out. And you can see that senior level women affected the most, and about 50% or over 50%. And pressure at work about 25%, but the people of color is about 20%. So you can see that. And this is a distance schooling, which is, because face-to-face schooling was not practical to control the disease spread. So there are several things that you should note and maybe find a solution for that. The one is a screen stress. So the children are supposed to be sitting in front of the computer, and the screens are limited in their dimensions. So you have to focus on a smaller area than versus the whole classroom. So that is, if they divert their attention, they miss the lesson or teacher communication. And the eye strain, say reflection, Uh, there's not much radiation, but it can cause eyes to be tired, and they can get redness of the eye. And they can, if they're too close sitting to the screen, they can get dryness of the eye as well. And so the treatment will be like eye drops, lubricants, and sitting further down away and not have a draft behind the computer, which will blow the hot air on your face. Lack of attention, the attention span of small children is very limited, and they can maybe have the full attention if they're interested 10 to 15 minutes. After that, they start getting uh, to stray outside the computer screen. So their attention span diminishes. And restricted interaction with classmates and teachers. Uh, this is different mode of education. It's not interaction with the other classmates, and you are one-to-one with the teacher, and sometimes the teacher does not have time to be one-on-one with each one of them. So certain students may get less time than the other. And so they might feel they are left out. The parents stress because to turn the computer on and sit there and have a discipline in the house, because these are not office environments, and there are disruptions, and the parents or someone adult has to be available around the children. So that has caused quite a few problems with their work, and also in other errands they run around. And in grading and assessment, if you do not have one-to-one contact, it's harder to assess the capability of learning in a student. So this is may not be the right grading or assessment, because it's a very difficult time of education. And then, of course, end of the day is a family strain, because children are glued to the computer for 4 to 6 hours.
Yeah.
And next normal, this will be the norms of the future, because things have drastically changed. We have seen this in the last 10 months, but how long it's going to be there, we don't know. Unless the vaccine and preventive measures come in and the virus goes away or gets under control, we are in there for a long haul. And some estimates are towards the end of 2021. And so for that long period of time, the medical care is most affected at this time. And hospitals are full to their capacity with infectious diseases, and people who are sicker than normal because their preconditions, diabetes, high blood pressure, asthma, has on top of COVID made them more vulnerable to get into respiratory failure. They'll need hospital admissions and ICU admissions. So face-to-face encounter is less because of the fear of spread of the illness. Elective surgeries and visits are down, and patients are, if they want to have their gallbladder out, they are not going there to have that done because they're scared of catching coronavirus. Emergency care, if you are, say, had a cold or or had a strained ankle or skin rash, if you go to the emergency room, it, you're inviting the viral infection and exposure because there will be sicker people there. And if they are not wearing the mask or they are not diagnosed yet, they just have the symptoms and or maybe asymptomatic, you will get an exposure when you're checking in. So they're trying their best to keep the distance 6 feet for each person. So telehealth came up, you know, like we have Zoom now, so Zoom telehealth, and there are so many other telehealth services available where you can log in and talk to the doctor. I had 2 visits with my cardiologist just on the telephone. And so they can order the test, they can look at the test, and they can monitor your medication. Similarly, chronic diseases, arthritis, diabetes, asthma, hypertension, you know, uh, and other acute ailments other than the chest pains, you can have pretty good results with telehealth. And I think there's a lot to explore in that. And it is quite private and accessible and reasonable. So, and a lot of insurances have gone to allow telehealth visits by their coverage wise. And the medical societies and medical examining boards have extended the licensing. So retired doctors or the doctors who have a license in one state, not the others, can get universal license, and they can go from state to state or treat patients on telehealth from different states during this period of infections. Gender gap, women leaving workforce, this is about the 30%. Uh, there was a survey, and they were either housewives or senior women there quitting and not going back to work. Auto sales dropped 30%, affecting a lot of economy in the manufacturing and sales departments, and also in the gas stations. And accidents are down. Travel industry, the airplanes, you know, the air travel is extremely um, affected by corona spread. They are working to very low capacity, and many may not even make it by the end of next year. Online retail sales, they have gone up, and you know, so the people are at home, and so they are doing more and more shopping by that. So this is your next normal. We got to get used to that. Telehealth visit, what's the benefit? Minimizing risk of exposure to other patients and healthcare providers, and minimizing spread of illness among members, family members, and the public. Providing care for chronic medical condition and continuation of treatment without interruption of care. So that is a big advantage. Preventing complications of diseases, and early diagnostic procedures. So this can be all achieved by telehealth. And this is changes from last week, 93,000 cases in one day. A group of Stanford University economists estimated that there have been at least 30,000 coronavirus infections and 700 deaths as a result of 18 campaign rallies President Trump held between June and September. So uh, there is a problem with the science fiction and all that. But if you believe in science, you got to consider taking the precautions. And this was preventable.
30,000 infections, 700 deaths.
And let's look at the drivers of spread of this illness. There's a pandemic anger. The people are just not happy of isolation and quarantine, and they want to travel, they want to do the meeting, they want to go out and have picnics, they want to go to restaurants and bars. They were opened in New York and they were open in Illinois, and now Illinois put the restriction back. They cannot have restaurants indoor because the air is not exchanged in the confined area. There is a spread of infection. There are lack of resources for control. Infectious diseases specialists are not available, and no one to date knows what is the best treatment for COVID-19 infection. Pandemic fatigue, people have to go to funerals and weddings and birthday parties and picnics. Just day before yesterday, they had a picnic in New York, Long Island, and they had about 51 people exposed from one person. And another gathering, they did some party in a club, and so there were 30 people affected from one, so they traced them back, and this club was fined $17,000 for breaking the restrictions law. The other place, wedding party, was not fined. Then colleges and universities, they had like 8,526 cases in about 13 schools, if I'm 31 schools. And so you can see that there was spread from, because they didn't wear masks and they didn't believe in social distancing. And now, this is the next slide. Yes. Transmission on the plane. There was a flight, 7.5 hours flight with 17-person capacity, 12 crew members. There were 13 cases, passengers from Middle East to Ireland. Ireland has a very strict follow-up and tracing rules, and 9 out of 13 wore face masks and 59 contacts were traced. So luckily there was no deaths, but they got control. So because it's a confined space, the seating, there was 1 in the first class and 2 people in the middle of the aeroplane, and the rest were in the back. And so a lot of seats were empty, but they did infect the other people. And coming home from Thanksgiving, transmission to household member is very common. Children and adults, they can both spread the illness. 50% household reported symptoms within 5 days of exposure. So that is, if you develop those symptoms, I'll go to them in a minute, you should quarantine. And this is COVID testing in immigration detention centers. ICE data from website. The daily detained population, immigration detention, decreased from 39,000 in February to 21,000 by August. So 5,300, 5,379 cases with 6 deaths. So very high rate. cases reported in 92 of 135 facilities. And it comes to 6,000 cases per 100,000 population, when in the general population is less than 500 cases per 100,000 population. So you can see how many times more this detainees got infected and have fatalities. And there was no measures of prevention there. There were no masking and no distancing. And escalating rapidly inside detention centers. So that's a big concern. Test turnaround time in nursing facilities. Rochester and Harvard universities did a study. They just published it, that 10% of facilities have a turnaround of 1 day and in the results. 40% 2 days, and above that 3 to 7 days. So small fraction of nursing homes have less than 1 day turnaround for staff.
Do that now.
So I think the sooner you find out, the better it is, because you still have to do the masking and till your results come out. And so this is an interesting study they have published. And of course, this is a slide from previous presentations. Infectious aerosol particles can be released during breathing and speaking by asymptomatic infected individual. They have no symptoms, but they can breathe and throw this virus. If they're not wearing a mask, it goes far further. But if you're wearing a mask, it minimizes the exposure. It minimizes and cut down the infection by 50%. So that's what we're looking in Cambria. Wear mask and keep the distance to keep the infection from spreading. We can do it.
There's two guys waiting to vote yesterday
Yeah.
on the street. Neither one of them.
Presenting symptoms of COVID, dry cough, fever, weakness, fatigue, muscle ache, headaches, nausea, vomiting, diarrhea, congestion, rash, loss of taste and smell. And quite interestingly, this was, I was looking at it, and these are the same symptoms for HIV infection. And but they don't have loss of taste and smell, but the rest is common. So it is extremely important to know that where you got the exposure to the COVID-19. So the tracing becomes extremely important. And of course, the age group and all that. But the younger age group also gets COVID in 20s to 40s and 50s. And the complication rate after 65 is very high. Vaccine status haven't changed. Johnson & Johnson, Lilly vaccine, and Pfizer. These are all on hold. And AstraZeneca is also paused. And dual SARS-CoV-2 influenza vaccine is a nasal spray. They haven't come out yet. November 1st was the date. I haven't heard anything, but China and Russia both are using RNA vaccine, and this has been used in Middle East as well. It was in phase 3. We don't know the side effects, but soon, if they have enough people receive it, we will get the safety data, and CDC will say something. And I think if we have the vaccine by middle of the year, 2021, we'll be safer in the fall. So these are the test sites in Cambria Fire Department operations 11/6, 11/20, and December 4, 8:30 to 4:30. It's a drive-through. And the Marshfield Clinic Health Center in Beaver Dam. And so these are the two sites available to us. I think we can utilize Cambria. Cody, are you there?
Yep, I'm here. We do have testing on Friday in Cambria. And then Columbia County is also authorized 2 more free testing sites. One is going to be in Portage, and I cannot remember where the other one is. But if you go on the Columbia County website, they are listed. They are free. It is put on by the National Guard, and it went really well last time. So hopefully it will go as well again this time. Yep, we had 220 people last time that came through. It was 3 to 7 days on average is what they tell you, 3 to 7 days.
Okay.